Hey guys, good afternoon. How are you guys doing today? Well, today we're here at Icon Cosmetic Center with our lovely surgeon, Dr. Tamer. So today we're going to be asking him a couple of questions, you guys. So whatever questions you guys may have, you can go ahead and put them in the chat, and I'm going to be reading them out to our doctor so that way, he can answer them for you, okay? So we're gonna start. I see already a couple of people have joined the live. How are you guys doing today? Hi, good afternoon, happy Thursday, you guys. So we're gonna start right away with our questions, any questions you guys may have. And if you're looking forward to scheduling your free virtual consultation or your free in-person consultation with Dr. Tamer, you can just go ahead and to my left bottom corner right here, you're gonna see a blue folder where you could click it and put your name, your phone number, and your email. That way we can get in contact with you guys, okay? So let's get started. So Dr. Tamer, do you recommend using Cell Saver for every patient? How does it help the patient?
So Cell Saver is interesting. It's a way of removing some of your the blood that you have and reusing it for you. So it helps the patient recover in cases where we may lose a certain amount of blood, or patients who already tend to have a low hemoglobin. It's really just for safety, but I have noticed that in recovery, even with not much blood loss, and even in cases where they don't have such a low hemoglobin, just that extra little bit of blood can be helpful. Of course, there's risks to it, so I would say discuss it with your surgeon directly and see if it's right for you. But when used correctly, it can be really helpful.
What is your approach to muscle repair and why is it necessary?
Okay, so I think you're referring to a tummy tuck here.
Mm-hmm.
And the muscle repair in a tummy tuck is very important. So especially if we're talking about females, when females get pregnant, they have to make room for they need to make room for the growth of the fetus, and as that happens, the muscles tend to separate. So females who've been pregnant will have that muscle separation, abdominal wall muscle separate. And with the tummy tuck, when I get to the level which is about the xiphoid here, you can kind of tighten those muscles back up to where they're more flat by suturing around them and obviously around the belly button. And that gives you a little bit of extra support. There's a lot of other benefits that come with that, and not only aesthetically in terms of your tightness, not having as much of a bulge there, being able to get more skin, but also talking to patients after surgery. There's other benefits that come with that. Obviously, you're going to be a little bit more sore after surgery, but in my view, when doing a tummy tuck, it's almost always necessary because it really does help with the outcome, both aesthetically and functional.
So it allows them to have that flat stomach look that they're looking forward to getting.
Absolutely.
Cool.
That's why liposuction alone, even if you won't have much loose skin, isn't really going to help with necessarily the flatness if you have that bulge there. Just, for sake of being proper, the term is diastasis recti in terms of like what that is called. You can look it up, kind of get some pictures. It's good to have that idea when you go talk to your surgeon of what exactly they're talking about, so that this way you can kind of see why they would want to tighten it up, how they want to tighten it up. You're not just grabbing some random parts, you're actually putting the muscle back to where its natural position is by tightening that fascia in around it.
Oh wow, doctor, I didn't even know that. How do you prevent dog ears at the incision site?
So dog ears, just to kind of explain the term, when you cut something out and the corners where you put them back together tend to kind of pucker out, and so it's kind of noticeable. Tummy tucks, breast lifts, breast dogs, sometimes you can't avoid them. I'd say more obviously tummy tucks, breast lifts, breast reduction, thighs sometimes, brachioplasty, that's inner arms. So that's kind of where you'd most see them. Sometimes you can't avoid them, but the role of the surgeon is to discuss that with you, and to kind of, when I see the surgery, I kind of plan out where I'm going to make my incisions, how I'm going to remove the skin, and at what angles, to kind of minimize the risk of that. And that's kind of, it's a big process looking at the overall aesthetic of the body, and also being able to kind of plan where your incision is going to be, and how much you're going to be able to transition the skin into where the incision is to try to limit that. Now, again, you're not always able to avoid them completely, but my goal is to try to plan for it, or at least discuss with you, hey, you're gonna be more likely to have a dog ear, or hey, we're really gonna try to taper it here so that this way we minimize your risk of having the dog ear.
Of course. So how do you determine the best implant type, saline versus silicone, and placement over versus under the muscle for a patient?
Oh, that's a pretty good question there. So with breast augmentation, I go back to, it's never one size fits all, and it doesn't match cup size directly. So think about it as, if you're someone that's petite, even if you feel like you have the same body style as somebody else, or if you're someone that's large that has a friend who had these large implants in, it's not always going to be the same for you, because your breast anatomy is different than their breast anatomy. And what I mean by that is where your breast tissue is in relation to the rest of your body, where the demarcation of the breast is in terms of where your actual breast tissue is, and that kind of helps determine where we can put the implant. So I do a lot of measurements, and that will tell me the base of where the implant will go, and how much your breast can hold base wise, not projection wise. And you never want to violate certain areas, including the area in between the breast, because then you can have risks of it breaking down further the tissue and then completely removing that demarcation between the breast, which you don't want. And then also on the outside, because that can allow the breast to kind of fold into the pocket. So those are the two areas you really want to restrict yourself from dissecting or cutting into. And so with that, then the options become less, right? Because now all of a sudden you're working within the size. You also don't want it to be too small within the size, because you don't want there to be a mismatch of breast tissue to implant size. So taking all that into account, and then you're determining based on your specific body. Again, I'm not giving advice as a whole, I'm just saying how I think about things. Depending on how your breast are and what you do. So typically the only time there's very few times I would refer to above the muscle breast implants. There are some exceptions, but for the most time it will be under the muscle, and most of the time for over the muscle it's going to be if you're a heavy lifter, if you have a certain type of breast tissue, if you have a little bit of a different type of breast tissue. So that there's definitely times where I will use over the muscle, but for the most part under the muscle seems to be a better fit. And then silicone versus saline kind of depends what people are looking for. I would say silicone now has a more natural feel and a more natural look the way that it is, and it also gives more options in terms of how the silicone is structured within the implant. So I would say definitely have those conversations with your surgeon. Each surgeon is going to be different, but for the most part, make sure you have that discussion so that this way you know that the surgery and the breast augmentation is what you're looking for your body and your breast, and make sure that when you're getting the recommendations from your surgeon that you're reminding yourself that just because your friend or your acquaintance or whoever had this certain implant and it looked really good on them, it may not fit you the same way. So try to avoid making those comparisons, because it just ends up adding pressure to yourself and maybe not giving you necessarily the result that you want.
So here I see that we have a question from MZ. Where are you located? So we're located in Miami, Florida, you guys, and Dr. Tamer is in the location in Hialeah of Icon Cosmetic Center, you guys, okay? So I'm letting you know right now, if you're looking forward to booking your free virtual consultation or your free in-person consultation, go ahead and leave your information right here in my left bottom corner in this blue folder. You guys put your name, your phone number, and your email. That way we can get in contact with you, and we can attend to your needs and your wants better.
It's blue on their side.
Mm-hmm.
Okay.
It's blue on their side here.
Like where the pink thing?
Yeah, right here.
I've learned.
Yeah. But what was I gonna say? So the next question is, how does having previous C-sections or abdominal surgeries impact a tummy tuck during a mommy makeover?
So if a tummy tuck is part of your mommy makeover, I would say the C-section scar is kind of a good place. I always try to go make sure that scar is removed. Again, try is the key word there, because sometimes there's not enough skin laxity, meaning stretch of skin, to get it down to that area. And also, depending where the C-section scar is, sometimes it just doesn't work with the aesthetics of the surgery. So while I pay attention to it and I try to remove it, it's just not always possible. And I will be upfront about that with you, as most of your surgeons will be. And the other thing, abdominal surgery in general. So certain abdominal surgeries will mean you cannot or should not get a tummy tuck. I'll let that be discussed directly with you. It's a case-to-case basis. But for the most part, other surgeries do impact a tummy tuck just because of scars, way you heal, kind of the way the skin may wrinkle, what we try to remove, and the scar tissue that we're gonna run into in the surgery that may either increase your risk or maybe alter the expectations that we have for your final results. Either way, case-to-case basis, I would say good discussion to have with your surgeon. That's why it's so important, guys, to let your surgeon know all the surgeries you've had. Even if you forget one and you remember 2 days before surgery, it's just always better than running into surprises. Now, our job is to be able to adjust to surprises well, and we do everything we can. But it's always better if you tell your surgeon right off the bat. Don't try to hide anything. Just be honest with them. We're trying to take the best care of you that we can, and just the more information we have, the better. So, saying all that to go back to her question, C-sections, we try to remove the scar if it's possible. Other surgeries impact us just based on the blood supply to the flap, as well as trying to accommodate the scars and the skin type to being within what we're cutting out. Not always possible, but it's always better to know, so that this way we can do what we can.
So we have another question here that says, from Keeping Up With Her, how are you doing today? Good afternoon. And it says, how many cc's for a dramatic BBL? I believe that they're talking about how much fat.
I'm sorry, I lost it. Can you repeat the question?
How many cc's for a dramatic BBL?
For a dramatic BBL?
Yeah, so I think that, that depends on the person.
Yeah, I honestly, I couldn't tell you that answer. Not because there's a certain number, but I think it's because it depends on the patient. And a dramatic BBL is kind of it's a term used. It's not a defined term, if you would. So it's hard to answer that question. It's mainly based on body type, what you're going to need, and kind of how it relates to what your goals are. So again, there's not really a CC number. It's just kind of a term used to describe a certain type of BBL. Does that? Hopefully that makes sense.
How do you determine whether a patient needs arm lipo alone versus an arm lift?
So I think this is going to be very much patient dependent. And I know that sounds like an excuse, but it's really, really up to the patient. And what I mean by that is a lot of patients will get bothered by the area under their arms and feel like the loose skin and possibly the thickness is bothering. And so if it's the thickness that's bothering patients, then lipo is to remove the fat, correct? Well, a lot of patients then don't want loose skin hanging when they wave. And so patients that get bothered by loose skin should have skin removed. Now, mind you, if you're getting your brachioplasty, your scar is going to go from elbow at least to about armpit. And those are big scars, and depending how you scar, that may be worse than having loose skin. So I would say I always do lipo with my brachioplasty, which is arm lift, two different terms for it. I always do liposuction with my brachioplasty because it allows me to get a little bit better surgical result. However, not every liposuction has to have a skin removal. So if the loose skin bothers you more than the scar, then I would say get the scar to remove the loose skin. If the scar would bother you more than the loose skin, then try liposuction first. Again, case-by-case basis, just something to keep in your mind when you're asking about these things. But it kind of depends what bothers you most about yourself, and nobody's going to tell you that besides you. So up to you. Either way, it seems to get really good results. And probably one of my favorite cases in the sense that patients are always really happy afterwards, because, especially when you have this discussion with them, they know exactly what they're getting from me. And if they are happy with the scar more than loose skin, they're going to be happy with the scar. Some people cover it up with tattoos. Some people, it doesn't even bother them. They're just happy they can wear tight shirts again. So it's definitely a nice procedure. It's definitely makes people happy, and it's one of my favorites for that reason. Like breast augmentation.
We love that. We love to see it. So we have another question here from the Honey KO. How are you doing today? Good afternoon. So the question is, how would you approach someone with a colostomy scar wanting a tummy tuck and contouring?
Can I read the question?
Yeah. Did I say that right?
Yeah, that's good. On contouring. Okay, so a lot of things in this. I definitely want to see the patient in this situation in person. The reason being because after a colostomy, so just so you guys know, colostomy could be a bag, could be a number of causes. But it's usually a circulatory scar, and there's a number of other complications that can occur with a colostomy bag. So it's definitely good to get your abdomen examined, maybe get a CT to make sure that there's no other hernias that could be going through. Obviously, make sure that the reason that you had the colostomy is no longer in play, meaning different people get colostomy bag for different reasons. Sometimes it's traumatic, sometimes it's related to another medical issue. And so if there's a chance you might get another situation like that, then you want to wait till all that is completed. So once all that's completed, and once you definitely go in to see your surgeon in person and get a CT scan, then I would say it kind of depends where the colostomy scar is. So depending on the type of colostomy and the cause for why the colostomy was there, the scar can be in different places, and I would try to accommodate it into the scar, but a lot of times based on its height, it's probably not going to be there. So you just kind of have to manage it appropriately. And then as far as the liposuction goes, it depends really how much scar tissue. This is definitely one of those patient case-to-case basis, but I would definitely recommend, even before, like pre-oping, going to see your surgeon to see what they recommend to kind of lead up to the pre-op testing, so that you don't get delayed as you get excited, and make sure that even before you get to that point that you're not likely to be in that situation again, if it's in your hands, obviously.
So the girl saying no colostomy bag, all fixed, very young, all good, lower left side. I believe, she was like answering back as you were speaking and answering back, and then she said, okay, thank you.
Yeah, definitely something that you want to go discuss directly in person, or at least on virtual. I mean, virtual will be fine because I'll be able to see it from there, like on the camera. But definitely something that you don't want to just surprise somebody a couple of days or weeks before surgery. You kind of want, this is one of those situations you definitely want it planned out in advance. Want to make sure everything's done the right way to make sure you're safe and that you're getting what you want. You'd hate to do all that, go through all the process, all the energy, all the healing, the surgery, and then still not be happy with the result because you didn't get what you want. So to me, it's really good to match expectations to results, and I think that was one of those that we'll have to talk in advance a little bit, but it'll definitely at least make sure that you're getting what you want.
How do you prevent sagging skin after inner thigh liposuction?
So with inner thigh liposuction, it's another one of those good procedures. Man, we do a lot of it. So you can't prevent sagging skin. That's going to be my first caveat. You can't prevent sagging skin. The only things you can do to help lower the amount of sagginess is, one, your skin quality as the patient. Two, doing a thorough liposuction. Three, massaging. Massaging is extremely critical because the first couple days, weeks as you're healing, it's very much malleable, meaning you can kind of change the shape a little bit. So massaging is very important in keeping it uniform and kind of giving you the desired contour. There's also adjuncts we have as surgeons. You'd have to ask the coordinators directly about that, but we have adjuncts in our arsenal in the OR that we can use. And I don't like to give my name because It depends on the brand. It depends on the surgery center, but there's a lot of similarities between them. And so, if you ask your coordinator, like, what can we do to tighten the skin? Let's say you don't want your skin removed. The scars are the worst thing in your mind. You'd rather have loose skin than scars, but you want to decrease the amount of loose skin you have. Then definitely ask your coordinator, because we do have adjuncts that they can suggest to you that we have in the OR that we can use that can help reduce the amount of loose skin for patients who don't want to have a lift, like a thigh lift. The other option is, if the loose skin really bothers you, just have the loose skin removed with an inner thigh lift. The inner thigh lift, the scar goes kind of along the crease of the groin. For females, that crease has to be about, so I test directly with the patient, because one of the complications of an inner thigh lift is it can affect the genitalia and make them more dry and make them more spread out, because it can actually, when it scars, it can pull them apart. So what I'll do in the pre-op is make sure that there's no tension wherever the scar is, to make sure that it will not cause that. So the reason I bring that up is because that scar hugs as close as it can to that line, but there's a certain point where it can't go right into that crease. So, but it is very close. So really, outside of a bathing suit, and in most cases even with a bathing suit, that scar won't show. But that's the only way to get rid of loose skin. The other adjuncts are to kind of help with loose skin, but there's no way to get rid of it without removing it.
So we have a comment here that says, "It is well with you, doc. Always brightening people's day and making dream goals happen."
Oh, I appreciate that. Thank you. That really means a lot.
That was so cute. So we have another question here that says, "I'm concerned if I get a BBL, it will go away because genetics. I only gain weight in stomach, no glutes."
So, by definition, a BBL is a transfer of fat from the abdomen and everywhere we lipo it to the glutes. By definition, we're moving that to there. Now, just like you can gain weight there, it can go to the buttocks. That said, it's one of those things, this kind of goes into liposuction too. Just because you get liposuction doesn't mean you can't gain weight. It just has to go to the areas where we haven't removed the fat. And as you know, because we discussed liposuction last time, you can never remove all the fat from an area. You would look not so great. So you can always gain the weight back. Another question I've had, if I gain weight, does it go to my butt instead of my stomach now that I got a BBL? I don't know the answer to that, but it can be gained anywhere you have fat.
How do you balance projection and width for natural looking BBL results?
That's a great question. Actually, this is it's like you were in a consult with me. This is a discussion I literally have with my patients, which is why it's so important for me to see everybody pre-op. And certain times I'll even ask for a virtual consult directly, even if it wasn't requested by the patient, because there's certain aspects where if somebody's asking for a BBL, I want to make sure that we can accomplish what you're looking for with the BBL. What I mean by that is some people want a natural look. By natural, they want that little teardrop. Now, when I do liposuction, just naturally, I give it a Dr. T touch on the back, with that little triangle. And that's really important for the liposuction because it delineates the top of the buttocks. So initially, you can, even with a liposuction, look like you have a nice curvature. Yeah. Now, some people will tell me, I want a shelf. And I'm like, all right, so then we actually start discussing how much of a shelf. Do you want it to be really sharp demarcation or do you want it to be gradual? So those are all conversations I have directly with the patient. And then we have it again right before surgery where I'm drawing with my marker. Okay, this is where we're going to add it. This is where we're going to add it. Sometimes people want more in their hips than looks natural. I would say I often caution against that. Because what may look good right away on the OR table may not look good 6 months from now when you're healing after the swelling goes down. The other thing I talk to patients about is where they want their fat. So for that was kind of going back to the question, whether it's projection or width. And that's a patient-to-patient basis, but I would say it is very much depend on the body type of the patient, but also the desires of the patient. What makes somebody feel concerned and insecure about themselves doesn't translate necessarily to the next person, even though they may have the same body type. So I would say some people with what I may have one patient who has hips that patient 2 would have loved, say that she hates her hips, and vice versa. So definitely a conversation that I like to have with my patients. No one answer for everybody. Sometimes what patients want surprise me, even me. I'm like, really? I would have thought you would have been more the other way. So I don't tend to judge. I don't tend to anticipate or overshadow what I think would work for certain people. But I will always give you my opinion, especially if it's asked.
So, Tiana, going back to the question about what if I have no glutes, like is it gonna be gain on my stomach? She said, but if I have no glutes, can the fat from the BBL in the glute go away?
So typically there's, just by research, there's about 60 or 70% fat loss after BBL. That's pretty typical. At any point, I mean, people can lose weight. So without knowing your specific case, I'd hate to conjure up a guess. I would say it's always possible, but there's always a given amount of fat that's lost with a BBL. Specific medical conditions may make it more likely that you lose more, but again, fat is fat, so if it's gained, it can be gained or lost.
Okay. So,
sorry, I know that wasn't a specific answer, but there's not really a good way to answer that one.
Can Cell Saver be used for every procedure?
Technically it can be used for every procedure, although again, with risks and with management, I'd say I take that personally as a case-to-case basis. Like I wouldn't use a Cell Saver on a chin liposuction, but technically if you had chin lipo to 6 other procedures, it could be part of that. So I wouldn't say it's surgery specific, but I would say I view it in a case-to-case basis.
So, how do you approach revision liposuction for patients?
That's a good question. So revision liposuction is a little bit more complicated than the initial liposuction, obviously. It's more scar tissue, it's more fibrinous, which means that it's tougher to get through. Fiber doesn't go into the doesn't get extracted by the liposuction as well as fat does, or as smoothly, or as uniformly. So it does change it a little bit, but I would say that typically, again, another reason to be really forthright with your surgeon before surgery so that they can kind of discuss all this with you. But yeah, all my patients who have previous lipo, I discuss with them, what the difference would be from their first lipo, what they can expect. I feel around to make sure and feel like, okay, this area is probably not going to get as much off because it feels more dense, it feels more fibrinous, it may not be as uniform. So those are all discussions to have with your surgeon, and the key is letting your surgeon know so that he can explain those things to you.
So here we have a question that says, what is the recovery time for a BBL and lipo? Someone here, Kia Nashe. Good afternoon.
Good afternoon. So usually it's 6 to 8 weeks, just kind of depends what part of the recovery. It's all about the body, and I say that to say, like, there's a reason that we wait 6 weeks before using muscles before you're allowed to lift. There's a reason we wait 3 to 4 weeks before you're allowed to get your heart rate up and your blood pressure up. There's a reason that it's 6 weeks before you sit, 8 weeks before you do this, and all of that to say it depends on the surgery you're having. I don't like to give generalizations because each surgeon with their experience starts to refine their post-operative care, and I've heard from too many people, well, I heard on XYZ that my recovery should only be this long. And to that I'd say each surgeon's different because they've seen the results as we do more and more surgeries, as we run into things that we didn't anticipate running into, in terms of like, oh, I went on this trip on this day, and now all of a sudden we have more information. Like, okay, now I know I'm not going to let a patient do that. You know, so as we get more experience and more refined, and oh, this patient had better results than I expected. She did this, he did that. So like, those are things that we always kind of add to our acumen. So I'll refrain from giving a generalization. I will say each surgeon has a little bit different tendencies and why they do certain things. But I would also go to say that there's a reason for all the post-op instructions we have here, for sure.
Of course, everything has a reason, you guys, okay? So, how does liposuction around the flanks enhance the final result of a tummy tuck?
So, this is one that's near and dear to my heart. I don't ever believe in doing liposuction to one area unless there's a reason to do liposuction to just that area. And what I mean by that is you have to look. So I look at patients as a whole. Like, I would see them as they were walking in the street in front of me, and what would I want them to look like? And if you just do abdomen and you just do back, then what happens to all this? I mean, when you look at someone in a silhouette and you see that silhouette, the thing that makes everything kind of uniform is the flanks, the hip, the area between here and here, back and front. And that's the area that I think is the most significant part that can be improved upon and can really make or break a liposuction. Now, some people, and you can feel when you pinch, some people they're just up and down for the most part. And so when you do a tummy tuck and you accentuate the hip by really lipoing that area, it can really bring the whole thing together. And instead of looking boxy, because you just pulled the skin down straight, you kind of pull the skin out in the middle, towards the middle, and then you refine the hips and the flanks. I think that makes a world of difference.
It looks beautiful.
Both in liposuction and in tummy tucks.
Yeah, you guys. So what post-op care techniques do you recommend to optimize liposuction results? You know, for them to be able to see that inflammation, that soreness go down and stuff.
So this is, I would say, surgeon dependent again. For me personally, I see the value in having a qualified and good masseuse. And what I mean by that is somebody who knows what they're doing and is specialized in post-surgical massages, has a different technique and knows what to look for and knows what to avoid more than someone who may not. And I've seen the value of that more recently. Wearing compression, it's important. It is.
Your faja, you guys.
Walk.
Every hour.
Walk.
15 to 20 minutes every hour.
Stay active. Patients that stay active recover quicker than patients that don't. I noticed that the anesthesia seems to affect them longer. They seem to be groggy longer. Protein always helps. Protein always helps healing. Keeping your eye on stuff, making sure to follow your surgeon's recommendations. There's a reason they recommend stuff. It's not just to say they wanted to recommend something. It's not just wasted ink on paper. Usually, I mean, I can tell you this about mine. Every line has a reason. Every line has a reason. There's not a line in there that I'm just like, oh yeah, we could just get rid of that. Like
very precise.
Yeah, there's a reason for everything.
So one last question, you guys. By the way, if you are looking forward to scheduling your free virtual consultation or your free in-person consultation, you can go ahead right here in my left bottom corner. No, it's in this one. And in both of our left corners, you guys, right here, put your name, your phone number, and your email. That way we can get in contact with you guys and we can put you in our schedule, okay? Another thing that I wanted to mention to you guys is that I saw that a couple of people were from outside of the state, or maybe you're watching me from outside of the country. Well, I'm here to let you know that has never stopped the show, you guys. We have iconic dolls worldwide, internationally, okay? So if you're looking forward to getting your surgery with Dr. Tamer, I'm telling you right now, we have free virtual consultations, okay, you guys? So go ahead and leave your information right here. So we have one last question. How do you approach breast asymmetry in augmentation cases?
So breast asymmetry in the consultation, I measure everybody. I mean, that's kind of, your surgeon should measure you. So I measure each breast separately. I kind of point out the different measurements, but a lot of it is hearing what the patient says to me in terms of, oh, this bothers me, or no, this doesn't bother me. If the asymmetry doesn't bother you, then I would say don't try to overcorrect it, because then by overcorrecting it, now you're almost changing the asymmetry to the other side. And so sometimes nothing's an exact science. Swelling changes things. Breasts are constantly changing. I've had a conversation with a patient where they're like, well, yeah, I noticed one day this one's bigger, and then, you know, depending on the day. Liposuction is another one of those where you just, the breasts, just treat them as two separate breasts. I mean, I've seen all different shapes and sizes in terms of like the differences, and just treat them like two separate breasts. If the asymmetry bothers you and you just want to be closer, meaning you just want a little bit less asymmetry, then I'll bring that up to your physician, your surgeon. If the asymmetry doesn't bother you before the surgery, it can be more drastic after, just because imagine if you had a little bit of a difference, then you put the same implant in, it could either lessen or worsen the degree of asymmetry. So I would say sometimes when the asymmetry bothers patients, I will use two different sizes. Sometimes I won't. It kind of just depends on what the patient's looking for, what the patient is bothered by, what their insecurities are, or what they just want to make them happy. Like sometimes patients just say like, oh yeah, I've always been bothered that this one is this much different than, now even when I measure it, it measures the same, but it bothers the patient enough to where if it's something that I can fix, I will do it, because that's really the goal of all this. But I also tell you at the time, like, if we fix this, anytime we fix it, it's not perfect, right? I aim for perfection, but the healing, the scarring, not always going to be perfect. So is it worth the risk of it not being exactly what you want for a little bit better, or are you happy with the way it is? Just want more augmentation on both sides. So again, conversation to be had, patient to patient, but there are things that I have in my little tool belt to help with those things if it bothers you. But don't think that there's a person, I don't know that there's a single patient I've ever met that was symmetric before I did surgery. So just think of them as two separate breasts. They're two different parts of your body. Try to get them as close as we can. And if there's something particular that bothers you or the patient asks me about, then I definitely discuss those, because there are some things that we can do to get things closer. So yeah. So you guys, if we missed your question, or if you would like to have a conversation with Dr. Tamer directly, go ahead and leave your information right here in my left bottom corner in this blue folder. Put your name, your phone number, and your email, you guys. Okay, so thank you so much, Dr. Tamer. I know you have to go see a patient. Pleasure.
So
thanks,
thank
guys.
you so much.
Do this again sometime.
Yes. We'll be back very soon with Dr. Tamer, you guys. And thank you so much for all those lovely comments. We are definitely going to be having more lives with Dr. Tamer, you guys. So, like I'm telling you guys right now, we are offering so many amazing specials, like this promotion right here that you see right above my head, you guys. I'm going to be talking about also the amazing financial plans that you could use to your advantage, you guys. So I'm here to let you know, here at Icon Cosmetic Center, we have 3 locations, okay? So we have one in Doral, we have one in Blue Lagoon, and we have one in Hialeah. The one in Doral is the one that I'm currently in right now, but Dr. Tamer, he's located in the Hialeah location. So let me explain to you guys. We have 8 surgeons here at Icon Cosmetic Center. All of our surgeons are board certified. All of our surgeons have over 10 years of experience, you guys, which is extremely important when you're looking forward to getting surgery. You want an expert to be working on your body. You want the person that is doing surgery on you to be able to deal with not only your body type, but multiple different body types, okay, you guys? So, like how I was saying, here at Icon Cosmetic Center, I see somebody here, Rosie's Precious Art, put, oh, is this in Texas? Hey love, how you doing today? Good afternoon, happy Thursday. We're located in Miami, Florida, Rosie, but for you and for everyone that's listening to me, let me tell you something. We have iconic dolls worldwide, you guys. Okay, so what does that mean? That whether you're outside of the country, whether you're outside of the state, we have iconic dolls everywhere, you guys. So we offer free virtual consultations and free in-person consultations, you guys. So it doesn't cost you a thing to get, you know, seen by a surgeon and have a professional opinion, okay? So Rosie and everybody that is listening to me, I would strongly advise for you to leave your information right here in my left bottom corner in this blue folder. Put your name, your phone number, and your email, you guys. That way we can get in contact with you. Extremely important that you guys do know that, you know, we have free virtual consultations, you guys. So in case you're sitting at home wondering, oh, you know, I don't know which procedure I should go with, or, you know, you may believe that you don't have enough fat for a BBL, or you may believe that you are in a little bit of a predicament because you're a bit confused with what your body type and what's going on and what your goals are. Well, I'm here to let you know right now that all you have to do is leave your information right here in my left bottom corner in this blue folder, you guys, so that way, you know, we can go right ahead and get in contact with you guys, okay? Rosie's Precious are okay. I'm in Florida. How much for a skinny BBL? So you guys, you see this promotion right here, right above my head. This is the promotion that right now is taking place with Dr. Tamer. We have promotions on every single surgery, you guys. The only thing that, you know, when I say the specials on the surgeries, for some reason TikTok kicks me out, you guys. I don't know. So that's why I'm telling you guys, leave your information right here in my left bottom corner in this blue folder, you guys. Put your name, your phone number, and your email. That way we can get in contact with you guys, okay? Another thing that I wanted to mention to you is these amazing financial plans right now that are taking place that can help you out so much into finally being able to get your surgery, you guys, okay? So there's a couple of things that you guys should know, you know. Thank you for answering. No, of course, Rosie, of course. Look, I'm here to help you out. We're here to help you out, you know. We're a very highly professional team that we're always gonna have your best interest in mind. We're always gonna prioritize your questions. You know, you guys, there's no such thing as asking too many questions or a dumb question. You know, there's nothing like that. Here at Icon Cosmetic Center, every single doubt and every single question is valid, okay? And we are gonna pay highly attentive attention to every single one of our patients, you know. I always wanna make sure that you guys feel like, okay, like they're helping me, they're guiding me, they're letting me know what it is that I need to know. So I'm letting you know now that with all of this information that I'm sharing with you right now about these amazing financial plans, this can help you out so much into finally being one step closer into getting your surgery, you guys, okay? So the companies that we do these financial plans with are Alpha on Credit and Care Credit, you guys, okay? So the financial plans are the following. For a BBL, you can pay as low as $29 weekly or $129 monthly, you guys, okay? For BBLs, you know, for a BBL, it's a fat transfer to the buttocks, you guys. So it's your own fat being transferred to the buttocks and the hips, you know, for more projection, more rounded glutes, you know, more volume, you know, more of that shelf, more hips, more of that hourglass figure. So, you know, you guys, that's what the BBL basically consists of. And if you're wondering, well, does Icon Cosmetic Center use ultrasound guidance for the BBLs? Yeah, we do, you guys. We do use ultrasound guidance for the BBLs. So let me explain in case you didn't know. When you get ultrasound guidance for your BBL, you know, what this basically does, what it helps with, what the purpose of this is, you know, because not a lot of people know what is the correlation in between the two. So that's why I like to get into detail about everything, so I can make sure that nobody's confused and that nobody feels like, okay, wait, I don't get it, okay? So when the surgeon, let's pretend like there's a butt right here, right? When the surgeon is injecting, you know, disposing the fat, placing the cannula, they're gonna be disposing the fat over the muscle. What the ultrasound guidance does for the surgeon is that they have a clear view of the inside of your buttocks the entire time throughout the surgery. So what does that mean? That while they're placing the cannula, they can see where the cannula is, they can see where they're disposing the fat, and they can see everything that is going on the inside of the buttocks, okay, you guys? So that's what the ultrasound guidance is meant for, to be used while, you know, a surgeon is performing a BBL, okay, you guys? In case you didn't know, you know, I like to explain it in case you didn't know. So like I was saying, for a BBL, the financial plans, you can pay as low as $29 weekly or $129 monthly, you guys. For a breast augmentation, you can pay as low as $18 weekly or $99 monthly, you guys. So for a breast augmentation, you know, you could go with either saline or silicone implants, you guys. Both options are amazing options. It's all about your personal preference, what it is that you're looking for, what your goals are, etc., right? So the 3 different types of incisions for a breast augmentation are the following. It could be one on the areola, one under your boob, or one through the armpit, you guys, okay? So these incisions, you know, and the implant size, you know, I get asked a lot, like, oh, you know, like, how do I know what implant size is the right one for me? The thing is that there's no way for you to know, you guys, because, and there's no way for me to know either, because I'm not a surgeon, you guys are not a surgeon, we're not board certified. You know, they call it the surgeon's eye, because surgeons, you know, they're so highly educated on absolutely everything that has to do with the human body anatomy and all of these procedures, that they can take a look at your breast, they can see how much breast tissue you have, they can see your skin elasticity, the width of your breast, and they can already see what implant size would be the best or the most appropriate for your body type, you know, because there is multiple factors that play out when we are choosing to get the right implant size for us, okay? And that would be the things I just mentioned, like how much breast tissue do you have, you know, how much space do you have for the implants, you know. Another thing would be like your skin elasticity, like how much is your skin tight, is your skin elastic, like how much can your skin stretch out for the implant. And another thing would be the width of your chest, you know, how wide is your chest, how much space do you have in your chest for, you know, the implant, okay? So all of these things do matter, and all of these things do play a part. So that's why it's extremely important for us to always go with our surgeons for accommodation, since they're the ones that are going to take one look at us and be able to see, okay, you know, this will be the most appropriate size for you. Since everybody's body is different, you know, it's extremely important for you guys to remember that and to keep that in mind, okay, you guys? So like how I was saying, for a breast augmentation, you can pay as low as $18 weekly or $99 monthly, you guys. For a Lipo 360, what it basically consists of is when we are removing unwanted fat, stubborn fat, that no matter how many workouts we do, no matter how much cardio we do, no matter how many sit-ups, you know, no matter how many miles we run or how many diets we try, this fat just won't go away. And you know, you guys, sometimes we store very, very stubborn fat in certain areas of our body that is extremely, you know, tough for us to get rid of, okay, you guys? So like how I was saying, for a Lipo 360, you can pay as low as $18 weekly or $99 monthly. And in case, you know, the name Lipo 360 confuses you, a 360 is a full circle, right? So that's exactly how the liposuction takes place, you guys. It's a full circle of your whole front abdomen area, you know, your back, your flanks, all the way up to the bra strap, you guys, okay? So that's exactly how the Lipo 360 will be taking place. And another thing that I wanted to tell you guys is that Lipo 360 is used to remove unwanted fat and stubborn fat, okay? And you'll understand why I'm saying that in a second. So for tummy tucks, you can pay as low as $18 weekly or $99 monthly, you guys. So for a tummy tuck is used to remove excess skin, you guys, okay? So if you're somebody that, you know, maybe you've had kids in the past, and you know, when we are pregnant, our stomach has to extend so our baby can grow. Now that you've given birth, you're experiencing some excess skin, you're experiencing, you know, a belly button that kind of looks like it's hooding down, or a belly button that kind of looks like a sad face. You know, all of these things are amazing indications that you will be a great candidate for a tummy tuck. But tummy tucks are not necessarily only for people that have been pregnant in the past, you guys. It could also be for somebody that, you know, maybe you were a little bit bigger in the past, and now that you were a little bit bigger in the past, now that you've lost the weight, you know, now you're experiencing some excess gain. Now you're experiencing your belly button kind of hooding down or looking like a sad face. You know, all of these things are great indications that you will be an amazing candidate for a tummy tuck, you guys, okay? Another thing that I wanted to point out that I've gotten asked a lot in one of my previous lives is that if I have excess skin, can I just go with Lipo 360? And the thing with that, you guys, is that you can do that, but it's a recommended, No, because the Lipo 360 is used to remove unwanted fat and stubborn fat, you guys. It is not used to remove excess skin. So if you have excess skin and you go ahead and just get Lipo 360, yeah, your waist might be smaller because you're removing the fat, but you're still gonna have excess skin, you guys. So that is something that is extremely important for you guys to remember, and for you guys to have the knowledge that these are things, every single surgery has a different purpose. Okay, so every single surgery has an end goal. Every single surgery has a solution for a specific issue or for a specific thing that is troubling you. Okay, so that's why I'm here to let you know that it's extremely important that we know the difference in between the two and why they both serve different purposes. Now, let's say that you want to get a tummy tuck and you want to add Lipo 360. You can go ahead and do that. You can surely go ahead and do that. Here at Icon Cosmetic Center, we can definitely make it happen for you guys. And we can actually combine procedures in many different ways, so that way you can get more of a complete surgery. And that way, you know, you can take the advantage that you're already getting surgery and get everything that it is that is bothering you. Okay, you guys? So why am I saying this? Because when people have little to no excess skin or lots of excess skin, it is important for you guys to remember that when we are experiencing lots of excess skin, the incision, there's two different kinds of incision for a tummy tuck. It could be a mini tummy tuck or a full tummy tuck. And the only difference in between these two is really the size of the incision, you guys, okay? So, what am I trying to say with this? That because of the size of the incision, it depends on how much excess skin you have. So, if you have little to no excess skin, your incision most likely will be the incision from bikini line to bikini line. If you have lots of excess skin, your incision most likely would be from hip to hip. Okay, you guys? So I'm here to let you know now that those are the difference in between the two. In case you've seen on social media like, oh, mini tummy tucks or full tummy tucks, it consists of the same thing, you guys. You know, it repairs the abdominal muscle, there's lipo on the flanks. Once they're done doing that, they stretch out that skin as much as they possibly can. They make sure that your belly button is so nice and centered and symmetrical with the rest of your body. And then they go ahead and remove that excess skin, you guys. Okay, so like I was saying, now for a tummy tuck, you can pay as low as $18 weekly or $99 monthly, you guys. For a mommy makeover, you can pay as low as $39 weekly or $39 weekly or $149 monthly. Okay, you guys. So for a mommy makeover, what it basically consists of is a tummy tuck, you know, what repairs the abdominal muscle, does lipo on the flanks, fixes your belly button. You know, maybe your belly button looks like it's hooding down or it looks like a sad face, and then they go ahead and remove the excess skin, you guys. Now, moving along, the mommy makeover also consists of a breast surgery of your choice, of your liking, of your preference. So it could be whether a breast augmentation, a breast lift, a breast reduction, or a breast fat transfer, you guys, okay? So I'm letting you know now, with all of these amazing options, you know, you have a very open room of many different options that you can choose for your breast. So let's say, for example, you're looking forward to getting a breast lift with a breast fat transfer, and you're wondering, well, can I do that here at Icon Cosmetic Center? You absolutely can, you guys. You absolutely can. Another perfect example would be, you know, what if I would like to get a breast lift with a breast augmentation because I want more of that upper pull fullness, I want beautiful rounded breasts, I want side boob, I want projection. I'm here to let you know right now that you can surely go ahead and do that. We can definitely assist you with that. And you know, what I'm telling you right now, we will surpass your expectations, you guys. What are you waiting for? To leave your information right here in my left bottom corner in this blue folder. You guys put your name, your phone number, and your email. That way we can go ahead and get in contact with you guys, okay? So another thing that I wanted to mention to you guys is that the mommy makeover, you can pay as low as $39 weekly or $149 monthly, you guys, okay? So for a labiaplasty, you can pay as low as $18 weekly or $99 monthly, you guys. So for a labiaplasty, what the labiaplasty consists of, and what, you know, who would be a good candidate for a labiaplasty would be somebody, for example, let's say that when you wear panties and clothes and you're constantly wearing panties and clothes, which, you know, we have to wear panties and clothes every single day for the rest of our lives. You can't go outside naked, right? So, you know, this is something that you probably deal with in your everyday life. So listen up to me. Maybe you can identify yourself with what I'm explaining. You know, because there is many women that do struggle with this, okay, you guys? So for a person that wears, you know, panties and clothes, or maybe pants and shorts, and, you know, it's extremely uncomfortable because the constant friction of the panties or the pants constantly going at your, you know, the outside part of your vagina, I am here to let you know right now that you don't have to keep suffering in silence, you guys. You don't have to keep putting up with this on a daily basis, because of course, you know, we can't go outside naked. You have to wear panties, you have to wear pants, you have to wear shorts, you know, you have to have clothes on. So this is something that you will literally deal with for the rest of your life. And I'm here to let you know right now that a labiaplasty can be the permanent solution for this issue, you guys. You don't have to keep suffering in silence. You don't have to keep being annoyed, or even being annoyed at the thought of even putting clothes on. I'm here to let you know right now that here at Icon Cosmetic Center, we have this amazing procedure that can definitely help you a whole ton. Okay, another thing that I wanted to tell you guys is a different example. Let's say, for example, when you're with your partner, you can't even focus on what's going on. You can't even enjoy yourself. You can't even have a good time because you're constantly thinking about, you know, what's going on in between your situation, what's going on, you know, you're constantly being self-conscious about your vagina. I'm here to let you know right now that you don't have to keep suffering in silence. You know, you don't have to keep not being able to enjoy yourself when you're in during intimacy, and when you're not, when you're just simply, you know, wearing clothes. I'm here to let you know right now that this labiaplasty is a solution for this kind of issue. It's a permanent solution, you guys. Okay, so for a labiaplasty, you can use this to your advantage in the sense that you could use it to rejuvenate the area. You can also use it to remove skin off the labial lips and off the clitoral hood, you guys. Okay, so these are things that are really important for you guys to remember, so that way, you know, you're like, okay, maybe you're on this live right now and you're listening to me right now, and I just mentioned something that you go through, that you put up with, that it's a life experience that you've lived through. And girl, I'm here to let you know that you could do something about it. You don't gotta keep suffering in silence. You could actually do something about it for yourself, so that way you don't have to keep putting up with that, you know. I'm here to let you know right now that the labiaplasty, you could use it to rejuvenate the area, and you could also use it to remove skin off the labial lips or off the clitoral hood, you guys. Okay, so for a labiaplasty, you can pay as low as $18 weekly or $99 monthly, you guys. Okay, for a tummy tuck and BBL, the combination of both procedures, you can pay as low as $18 weekly or $99 monthly, you guys. And this tummy tuck and BBL procedure, you know, combined, is a perfect example of how we can combine our procedures, you guys. Okay, so, you know, we can combine procedures in many different ways, you guys, which is so amazing to see, for you to be able to achieve a more complete surgery. Okay, so like I said, for a tummy tuck and BBL, the combination of both procedures, you can go ahead and pay as low as $39 weekly or $149 monthly, you guys. For lipo and breast augmentation, the combination of both procedures, you can pay as low as $39 weekly or $149 monthly, you guys. So I'm letting you know now, with all of these amazing promotions taking place, it is honestly so easy. It has never been easier for you to finally get your surgery, you guys. So what are you guys waiting for? You know, there's many different ways as to how we can also combine the procedures. You know, you can combine a procedure, a BBL with a breast augmentation, a mommy makeover with a BBL and a vaginoplasty, a liposuction with some ab etching and chin lipo and a labiaplasty, a BBL with a tummy tuck and arm lipo, inner thigh liposuction, lipo 360 with some upper back lipo. You know, there's so many different ways as to how you can combine these procedures, you guys. A breast reduction with a BBL with a vaginoplasty, you know, with some chin lipo if you like. You could also add arm lipo if you like. There's so many promotions going on right now, you guys, and there's so many different ways as to how you can combine your procedures. And all of our surgeons here are all board certified, you guys, and they all have over 10 years of experience, which is so amazing to see. So I'm letting you know right now that Icon Cosmetic Center is the right place for you guys. So what are you waiting for to, you know, leave your information right here in my left bottom corner in this blue folder, you guys. Put your name, your phone number, and your email. That way we can get in contact with you guys. Also remember, we do offer free virtual consultations and free in-person consultations, you guys. So if you're wondering, well, what if I stay outside of the country? What if I stay outside of the state? I'm here to let you know right now that here at Icon Cosmetic Center, that never put a stop to nothing, you guys. We have iconic dolls worldwide, internationally. So I'm letting you know now, What are you waiting for to finally take that next step and prioritize yourself and go after what you want, you guys? You know, it is extremely important that us as people, as humans, we prioritize ourselves. It is 2025, April 2nd. What are you gonna do about it? What are you gonna do about your situation? Are you gonna keep dealing with the things that you don't want to deal with? Or are you gonna do something about it, you guys? And I get it, how sometimes it can be a little hard to go ahead and do something about it, but I'm letting you know now that with Icon Cosmetic Center, with all these specials, with these financial plans, it has never been easier, you guys. So go ahead and leave your information right here in my left bottom corner in this blue folder. You guys put your name, your phone number, and your email. Also, catch this amazing promotion that we have going on with Dr. Tamer, you guys, okay? Remember that here at Icon Cosmetic Center, all of our surgeons are board certified, you guys. And by the way, we have 3 locations here at Icon Cosmetic Center. We have one in Doral, which is where I'm currently in right now. We have one in Hialeah, and we have one in Blue Lagoon, you guys, okay? And don't forget, we are matching your deposit, you guys. We are multiplying your $250 deposit times 2. So now you're going to be having a $500 deposit that is going to be going towards every single surgery with every single surgery, you guys. So I'm letting you know now. And also, we have another promotion where you can get 2 extra areas of free lipo, you guys. So what are you waiting for to leave your information here, your name, your phone number, or your email, whatever is the best way to get in contact with you guys? What are you waiting for? The time is now. This is your year. You can step into a new era of yourself. By the way, the surgeons that reside in every single location are the following. Here in Doral, the doctors that reside here are Dr. Fisher and Dr. Porter. The doctors that reside in the Hialeah location are Dr. Tamer, Dr. Zong, and Dr. Harrow. And the doctors that reside in the Blue Lagoon location are Dr. Meridian, Dr. Gurani, and Dr. Giselle Gurani, you guys, okay? So thank you guys so much for joining the live today. You know, stay tuned as we are going to be coming back with Dr. Tamer and with lots of exciting information that you guys can surely take advantage, great advantage of. Okay, you guys, so thank you guys so much for joining the live today. Make sure you're leaving your information here. Go ahead and make sure and leave your information here in my left bottom corner in this blue folder, you guys. Don't think that these promotions are going to be around forever. And you saw it here firsthand, you guys. Here at Icon Cosmetic Center, you know, we are always going to prioritize you. We're always going to have your best interest in mind, you guys. So extremely important that you guys do remember that. So like I said, thank you guys so much for joining the live today. We'll see you back very soon. And stay tuned, you guys. Oh, one last thing before I forget. Go to Icon Cosmetic Center on our Instagram. Go to the pin post. Follow all the instructions so that way you can go ahead and get a chance into being the lucky winner, you guys. The winner is going to be announced on April 10th. So you have exactly a week from now, you guys. Go ahead and go to Icon Cosmetic Center on our Instagram on the pin post. So that way, you know, maybe you could be a lucky winner. Let your friends and family know so that way they have a chance at also participating, you guys, okay? So, thank you guys so much for joining the live today. Thank you guys so much. And I see here, Kiana Shea definitely entered. I know that's right, girl. You can't let this amazing promotion, you know, just pass by you, you know? So thank you guys so much for, you know, being in this live today. And make sure you guys are leaving your information here too, okay? Leave your information right here in this blue folder. Put your name, your phone number, and your email, you guys. Thank you guys so much for joining the live today. We'll see you back very soon. Bye.